Hello, dear students. Today we will speak about factors that affect the formation and mineralization of dental hard tissues. Of course, we will speak about type of prevention of dental caries in children and indication, means and mechanisms of action, methods of application. Let's start. So, development of temporary teeth, NH and intermandibular formation, this first stage. Next one is eruption, then formation of root and periodontal, stabilization and resorption of root. Period of intermandibular formation. So you can see three periods. It is formation of dental plate and dental kidneys. It is 6-10 weeks of embryonic development. Differentiation of dental germs and histogenesis of dental germ tissues. Cutting teeth, though teething of temporary teeth starts at 5 to 6 months of life and ends up to 2.5 years. Teething from 4 months and 2 years is called early, and teething from 8 to 10 months to 3 and 3.5 years called late. So some introduction primary teeth are often called deciduous teeth. The word deciduous comes from a Latin word decidere, meaning to fall off. Deciduous teeth fall off or are shed like leaves from a deciduous tree. These teeth are shed and then replaced by permanent successors. This process of shedding the deciduous teeth and replacement by the permanent teeth is called exfoliation. Exfoliation begins from 2 to 3 years and after the deciduous root is completely formed. At this time, the root begins to resorb and its apical and resorption continue in the direction of the crown until the entire tooth is resorbed and the tooth finally exfoliated. Very necessarily information about root and periodontal formation, about different stages. Please write this in your synopsis. Stage number 1, it is period of incomplete root growth in lens. Look please, in lens. A short root, we can see on the X-ray, its walls are projected in the form of two parallel light stripes, which gradually become thinner and wider towards the growth zone, forming a bell. The root canal looks like a funnel, the expanded part of which merges with the growth zone. Stage 2, it is a period of the unformed apex. Look please on X-ray, the root of the usual lens, yes, and its walls are parallel, gradually thinning towards the apex. The periodontal slit has a uniform width, merges with the growth zone. Stage 3, unclosed apical foramen, the wall of the root approach but do not completely close. The root canal is wide and periodontal fissure widened at the apex. So you can see do not completely close apex. Stage 4, it is deformation of the periodontal jab. Stage 5, when you can see a fully formed root and periodontal tissues, periodontal jet, cement, periodontium, and alveolar structure, and all single system. The stage of the formation of root and periodontal lasts from 1.5 years to 2 years for incisors, and from 2 to 2.5 years for canines and molars. Some things importance of primary dentition. The loss of primary teeth tends to disturb the eruption sequence of permanent teeth. The primary teeth are used for performing mastification of food and assimilation during one of his most active periods of growth and periods of development. Primary dentition is very important for the maintenance of proper diet. Maintenance of adequate spacing and arch continuity for the emergency of permanent teeth is one of the most important functions of primary teeth. The primary teeth also performs a function that stimulated the growth of the jaws through mastification, especially in the development of the head and of the dental arch. Primary teeth also serve a cosmetic function for improving the appearance of the child, maintains a normal facial appearance. Resorption helps in guiding the erupting permanent tooth into the proper location. So what about stabilization? This period functional and full temporary bite lasts 2 and 2.5 years. So replacement occurs from 5 to 6 years, and temporary bite on a permanent resorption root of deciduous teeth starts with spots and which is closer to the germs of the permanent teeth. The terms of the development of deciduous teeth, you should learn this table, because you will have this knowledge for your practice and for tests and for some practical tasks. Development of permanent teeth, or also NH and internal jaw formation, eruption, formation of root and periodontal, and 4 steps, it is stabilization. We don't have here a resorption of the roots. Period of intramandibular development of permanent teeth from 24 to 25 weeks, it is 5 months of pregnancy, the rudiment of first permanent molar is formed. For 8 months of intrauterine development occurred the laying of permanent incisors and permanent canines. At birth, the child has 16 permanent teeth, 16 germs. The germ of the first premolar is laid at the age of 2 years of the child's life, from 1.5 years to 2 years. The germ of the second premolar at 2.5 to 3 years, and the same is for second molar. The germ of the third molar, it is age of 5 years. Then the terms of the development of permanent teeth, also you should know this table. You should write this table in your synopsis. I will check it. At the birth of a child, following mineralized incisors, it is 1.5 canine crowns, occlusal surface, temporary molars, and the medial buccal tubercle of the first permanent molar. First molar, it is 2 months, all bumps are mineralized, 9 months is completely occlusal surface, 3 years whole tooth crown. For the central incisors, 2 months mineralization of the incisal edge, 9 months, 1 1/3 of crown, 2 years, 1 1/2 crown, 3 years, crowns formed by 3 and 4. Lateral incisors, from 3 to 4 months mineralization of the incisal age. 1 year it is 1 1/3 crown, 2 years, 1 1/2 crowns, 3 years it is crowns formed by 3 and 4, and 4 years fully mineralized crowns. For canines, 4 and 5 it is beginning of mineralization, 3 it is 2 1/3 of the crown is formed, 6 years fully mineralized crown. First premolar, 2 and 1/2 years beginning of mineralization, 4 years mineralization of 2 1/2 crown, and crown will formed in 6 years. 7 years is fully mineralized crown. Second premolars, 3 years is beginning of mineralization, 5 years it is 1 and 4 mineralized crown. Second molars, 3 and 5 the beginning of mineralization, 4 1/2 it is mineralized entire occlusal surface. 6 years 2 1/2 crown. 8 fully mineralized crown, and third molars, 8 years the beginning of mineralization, and 12 years the crown is full formed. The process of deposition of mineral salts in organic matrix of enamel is called mineralization. There are two phases. First phase it is a primary mineralization, and secondary after teasing of teeth. And some historical information about homeostasis of tooth tissues. So the term of homeostasis was proposed in 1929 in of American physiologist Cannon, who combined under this name and complex the multifaceted physiological processes that maintain the stability of the body. The main enamel epitide is hydroxyapatite up to 75%, which contains of 10 calcium molecules with a calcium and phosphorus molar ratio of 1.67. Please remember this ratio because you will have some tests. Other apatites, it is carbonapatite. It have 90%, chloropatite it is 4.4%, and the small it is fluoride apatite 0.66%. And you can see a chemical picture about formation of fluorapatite by substitution of the hydroxyl group. Please look at first picture and the second picture. Features of the structure and physiology of tooth enamel. Enamel is characterized by a high degree of mineralization, but at the same time solubility and permeability to anorganic and organic substances. The ability to demineralize and remineralize processes. So you can see a process of demineralization of enamel and remineralization. So it is acid. Yes. Demineralization of enamel is an active exit of the main mineral components of calcium and phosphorus from the crystal structure of apatites under the influence of the adverse effects of various factors. So these factors can be endogenous and exogenous, which leads to a decrease in enamel resistance and increases its permeability. And demineralization of enamel, here you can see pH of the oral cavity, and if this pH will be lower than 5.5, we will have a process of demineralization of enamel. Remineralization is the filling of vacancies in the crystal structure of apatites, which were formed as a result of a pathological exit, in particular calcium and phosphorus. Calcium, phosphorus, fluorine are involved in remineralization. Remineralization is associated with artificial active saturation of the enamel with mineral substances. So when we work with in pediatric dentistry, we should know about some questions for parents. First of all, where did the woman live while pregnant and the child in the first month of the life? Professional activity during pregnancy, the course of pregnancy and childbirth, diseases and bad habits during pregnancy. What medication did the woman take during this period? Type and duration of feeding. Yes, illness of a child in the first year of life. What medication did the child take? Their duration. What is the child's illness now or not? Mode and nature of food, frequency of receptions, why gives priority? What is the condition of teeth in parents and other relatives? So these things you should know and write in the personal card of patient. Oral examination, determination of the type of bite and the presence of dental velar animalis, determination of the amount and viscosity of saliva, compliance with the physiological timing of teething, determination of the shape, size of teeth, detection of violations of the color and structure of enamel, of dentin, determination of the intensity of caries, of hygienic state of oral cavity, of availability of orthodontic equipment. So factors that affect the formation of deciduous teeth at the stage of primary mineralization. From the mother side, it is age, it is unfavorable social conditions, the presence of industrial hazards, bad habits, poor nutrition, acute or exacerbation of chronic diseases, taking medication, toxicosis during the period of pregnancy, birth complication, low fluoride content in water, and some genetic factors. Factors that affect the formation of deciduous teeth at the stage of secondary mineralization. It is dysbacteriosis of the intestine, early teething, failure to comply with the rules and feeding regime, excessive carbohydrate intake, irrational intake of medication, congenital anomalies of hard dental tissues, poor or lack of oral hygiene, yes, chronic somatic diseases. Factors that affect the formation of permanent teeth at the stage of primary mineralization, diseases of women in the second half of pregnancy, diseases of the gaster maybe or endocrine system, toxicosis of the second half of period of pregnancy, bad habits, acute and chronic diseases, taking antibacterial drugs, poor nutrition, low fluoride content in water. Factors that influence formation permanent teeth in the stage of secondary mineralization. The presence of chronic diseases in the child, violation of the qualitative and quantitative composition of saliva, violation of the development of hard tissues of teeth, poor oral hygiene, orthodontic pathology, a use of orthodontic appliances, and excessive intake of carbohydrates foods. And what about prevention? Prevention it is system of state, social, hygienic, and medical measures aimed at ensuring a high level of health and preventive disease. And you should know about some types of dental caries prevention, such as primary, secondary, tertiary prevention, and depending on from a timing introduction, it is antenatal and postnatal. By way that we can use for funds, it is endogenous, so systemical or general, and exogenous, so it can be local, and by degree coverage contingent of population, so it can be population, a group, and individual prevention. Endogenous non-drug, so what we can do is strengthening somatic health baby, reorganization of chronic diseases, internal organs and systems, rational nutrition from balanced admission proteins, carbohydrates, fat, macro trace elements, and vitamins. Use water and other products from optimal contained fluoride. What about the genus drug? It is destination fluorine, prescribing calcium supplements, phosphorus, macro, micro elements in combination with some vitamins. Destination drugs, what kind influence on the immunological reactivity of organism? Fluoridation of drinking water, you should know about this method because it compared to cheap, safe, and it is effective method of endogenous preventive of dental caries. The first artificial fluoridation of tap water was carried out in 1945, and in Ukraine it used at 1966 year ago. Now the method is widespread in more than 39 countries, reaching about 170 million people who are taking preventive measures, and for artificial fluoridation of water and waterworks using special equipment. So we should know optimal concentration of fluoride in drinking water. It is ratio from 0.8 to 1.2 milligrams to liter, and fluoridated water must be consumed from birth to achieve maximum effectiveness. And value. Fluoridation drinking water promotes decline gene caries for temporarities by 40 to 50% and permanencies by 50% to 60%, increases quantity person from intact teeth, declines speed progression caries process, and decreases quantity complicated caries. Of course, we should speak about advantages and disadvantages. For positive properties, we should learn about technical availability, relative cheapness, and possibility, so automatic health improvement without motivation of patient. And some negative properties, it does not have the ability to implement in the absence of central water supply, and does not have an accurate dosing within need to use special equipment and trained their staff. The first result in 5 to 8 years, prevention of caries mainly on smooth surfaces is 62% and in fissures and pits 26%. Fluoridation drinking water in schools carried out in regions where it is impossible to organize a centralized fluoridation of water. The concentration of fluoride is from 1 to 1.5 times higher than the optimal. So it is can be from 2 to 3 milligrams to liter. For individual use in home conditions, enrichment drinking water, it help household filter, for example, Barrier 5, contain fluoride in water 1.2 milligrams to liter. An alternative method in fluoridation of milk, of course, it is a natural source of calcium and phosphorus. The concentration of fluorides in milk for preschool children is 2.5 milligrams, for school children up to 5 milligrams, and in a region with low fluoride level, 200 milliliters of milk should be consumed daily for not less than 200 and 250 days for all year. Method used many countries, and you should know about fluoridation of salt. Concentration 200-250 milligrams in sodium fluoride. The effect of fluoridation of table salt approached the effect of fluoridation of drinking water. If fluoridation of drinking water is impossible for economic or technical reasons, or without, for example, central water supply. And disadvantages of this method, their complexity of individual dosing and the need for periodic monitoring of the fluoride content in urine. Technologically, it's a very difficult process. And you can see what countries use this method. And balanced diet. So first of all, it is general balance at all, and compliance of the diet with the energy requirements for of the body, sufficient intake of mineral components, requirement of consumption of simple sugars, minimum consumption of carbonated drinks, and support for self-cleaning of the oral cavity. So calcium content in food products. Here you can see some products and content of 1 milligram calcium for 100 gram. Some products that have cholestatic diets, so it is foods balanced in calcium and phosphorus content. So for example, it is green pea, apples, it is salad, pumpkin, you can see carrots, fresh cucumbers, all types of cabbage, so some sea bream. Products that contain fluoride, it is green tea, cereals, liver, it is chocolate, sardine. Magnesium, it is natural synergist calcium, and at lack magnesium declines bioavailability calcium and decline vitamin of groups A and groups D. Food contain magnesium, it is avocados, bananas, salad, garlic. Products that contain vitamin D, very necessarily vitamin for uh, people. It is in the fish, in eggs, so in caviar, fish, in butter, in liver. Sorry. And the genus preventive, so taking medication of fluorine, calcium, phosphorus, and trace elements, vitamins of group A, B, C, D, and drugs that affect the immunological reactivity of the body. Biological function of calcium, so you know that it is major structural component of bones, of teeth, and vitamin, this microelement takes part of the process of muscle contraction, and it is mediator of intracellular metabolic processes, so activator of cell enzyme system. And the norm is 400 and 1200 milligrams, and for pregnant women it is 1600 milligrams. Indication for prescribing calcium supplements, so children in the period of intensive growth, so for rickets treatment, complex treatment of dental, of periodontal diseases. But in pediatric dentistry, we should doing a mixed consultation with pediatrician, and contraindication to the appointment of calcium supplements. Yes. First generation calcium supplements, you can see here name and content of medication. So first it was calcium gluconate, calcium lactate, glycerophosphate, and 2,4-methyl-sulfite DESA, and percent from this medication. And the second generation of calcium supplements, look please, it is calcium D3 Nicomed, Vitrum Calcium, company uniform, calcite, and mineral complex calcium with vitamin D. Guys, please remember, because you will have tests with these supplements. And calcium preparations of the third generation, it is calcimina, calcinova, calcinova granulate, calcivita, biocalcivit, leca-DZ, and osteovit. And here you can see a connection, you can see other components in these supplements, and you can see age from 5 years old, from 2 years. So when you can prescribe this supplement, you don't prescribe this supplement for child, because you should do it mixed consultation with pediatrician, please remember. And some rules: reception calcium containing tablets, so through 1-2 hours after night, and requests water or juice, recepting vitamin A and D, and you not take at the same time from with antigenes with calcium, antacids, so tetracyclines, and course of treatment is 3 months. It is minimum. Biological function of endogenous fluorine, it is increased activity of alkane and acid phosphatase of bone. It is regulation of calcium homeostasis. It is formation of centers of mineralization of tooth bone buds. It is educational fluorapatite, uh, formation of fluorapatite, sorry, remineralizing effect on enamel through saliva, and the effects of fluoride compounds of the enamel of the teeth depends on the time of admission. So to cutting, it is the size of the crystals of hydroxyapatite increases, reduce carbonate content, yes, and a replacement of hydroxyl groups here should be enamel gets stronger, fissures more shallow and more wide. If fluoride compounds arise after teasing, so decreased enamel solubility and remineralization and demineralized enamel. Daily age needs of fluoride norms. So you can see age and fluoride equipment and sources of fluoride. So about 2 years old, about also food, water and dental toothpaste and percent. Indication for the use of fluoride preparation: low content fluoride in water, high morbidity carries teeth immun population, and absence additional sources introduction fluoride, total risk emergence of caries and carcinogenic diet. Features of the use of fluoride preparation: in the evening before going to bed, and do not take calcium, magnesium, aluminium. Duration 250 years for all days for all year, and a summer break. Thanks for your attention. I wait for your synopsis, and have a good luck. Goodbye.